Top mental health research methods practice for students. Question 1. Kyle, a patient with schizophrenia, began taking the first-generation antipsychotic haloperidol, Haldol, last week. One day you find him sitting very stiffly and not moving. He is diaphoretic, and when you ask if he is okay, he seems unable to respond verbally. His vital signs are BP 170/100, P 110, T 104.2 a degree F. What is the priority nursing intervention? Select one that does not apply. Option A. Hold his medication and contact his prescriber. Option B. Wipe him with a washcloth wet with cold water or alcohol. Option C. Administer a medication such as benztropine to correct this dystonic reaction. Option D. Reassure him that although there is no treatment for his tardive dyskinesia, it will pass. The correct answer is option C. Administer a medication such as benztropine to correct this dystonic reaction. The patient's symptoms, including stiffness, diaphoresis, inability to respond verbally, and vital sign abnormalities, are indicative of neuroleptic malignant syndrome NMS, a serious and potentially. Question 2. Which response demonstrates accurate information that should be discussed with the female patient diagnosed with bipolar disorder and her support system? Select the incorrect one. Option A. Remember that alcohol and caffeine can trigger a relapse of your symptoms. Option B. Due to the risk of a manic episode, antidepressant therapy is never used with bipolar disorder. Option C. It's critical to inform your healthcare provider immediately if you are experiencing sleep disturbances. Option D. Is your family prepared to be actively involved in helping manage this disorder? The correct answer is option B. Due to the risk of a manic episode, antidepressant therapy is never used with bipolar disorder. In managing bipolar disorder, it is vital to educate the patient and their support system about triggers like alcohol and caffeine, the significance of good sleep, and the need for family involvement. However, Question 3. Maggie, a child in protective custody, is found to have an imaginary friend, Holly. Her foster family shares this information with the nurse. The nurse teaches the family members about children who have suffered trauma and knows her teaching was effective when the foster mother states. Option A. I understand that imaginary friends are abnormal. Option B. I understand that imaginary friends are a maladaptive behavior. Option C. I understand that imaginary friends are a coping mechanism. Option D. I understand that we should tell the child that imaginary friends are unacceptable. The correct answer is option C. I understand that imaginary friends are a coping mechanism. Imaginary friends can serve as a coping mechanism for children, especially those who have experienced trauma. They can provide comfort and a sense of control in challenging situations, acknowledging and supporting. Question 4. Which therapeutic intervention is most effective for social anxiety disorder? Option A. Group therapy. Option B. Behavioral rehearsal. Option C. Cognitive behavioral therapy. Option D. Medication management. The correct answer is option C. Cognitive behavioral therapy. Cognitive behavioral therapy (CBT) is considered the most effective therapeutic intervention for social anxiety disorder. CBT helps individuals identify and change negative thought patterns and behaviors associated. Question 5. Which statement is an example of reflection? Option A. I think this feeling will pass. Option B. So you are saying that life has no meaning. Option C. I'm not sure I understand what you mean. Option D. You look sad. The correct answer is option B. So you are saying that life has no meaning. Reflection is a communication technique where one person mirrors or restates the content or emotion expressed by another person to demonstrate understanding and encourage further exploration. The goal is to capture. Question 6. A patient with bipolar disorder has been prescribed lithium. Which dietary advice is important for the nurse to include? Option A. Avoid foods high in tyramine. Option B. Maintain a consistent salt intake. Option C. Increase protein intake. Option D. Avoid foods high in fat. The correct answer is option B. Maintain a consistent salt intake. Patients prescribed lithium should maintain a consistent salt intake to prevent fluctuations in lithium levels. Salt intake can impact lithium levels, and sudden changes in salt intake can affect how the body absorbs. Question 7. In addition to anti-anxiety agents, which classification of drugs is commonly prescribed to treat anxiety and anxiety disorders? Option A. Antipsychotics. Option B. Mood stabilizers. Option C. Antidepressants. Option D. Cholinesterase inhibitors. The correct answer is option C. Antidepressants. Antidepressants, especially selective serotonin reuptake inhibitors (SSRIs) and serotonin norepinephrine reuptake inhibitors (SNRIs), are frequently used in the treatment of anxiety disorders. These medications help. Question 8. When attempting to determine a teenager's mental health resilience, what assessment question should the nurse ask that is not applicable? Option A. How did you cope when your father deployed with the army for a year in Iraq? Option B. Who did you go to for advice while your father was away for a year in Iraq? Option C. How do you feel about talking to a mental health counselor? Option D. Why would you think that is a better option than meeting with me? The correct answer is option D. Why would you think that is a better option than meeting with me? Assessing a teenager's mental health resilience involves exploring coping mechanisms, support systems, and attitudes towards seeking help. Option D is not relevant to assessing resilience but rather focuses on the Question 9. Adolescents often display fluctuations in mood along with undeveloped emotional regulation and poor tolerance for frustration. Emotional and behavioral control usually increases over the course of adolescence due to Option A. Limited executive function. Option B. Cerebellum maturation. Option C. Cerebral stasis and hormonal changes. Option D. A slight reduction in brain volume. The correct answer is option B. Cerebellum maturation. Adolescence is marked by significant neurodevelopmental changes that influence emotional regulation and behavioral control. The correct answer, B. Cerebellum maturation, is supported by research showing that the Question 10. Which of the following medications is commonly used to treat attention deficit/hyperactivity disorder, ADHD? Option A. Haloperidol. Option B. Fluoxetine. Option C. Methylphenidate. Option D. Clozapine. The correct answer is option C. Methylphenidate. Methylphenidate is a central nervous system stimulant commonly used in the treatment of ADHD. It helps improve focus, attention, and impulse control in individuals with ADHD. Haloperidol and clozapine are. Question 11. Which factors tend to increase the difficulty of diagnosing young children who demonstrate behaviors associated with mental illness? Select one that does not apply. Option A. Limited language skills. Option B. Level of cognitive development. Option C. Level of emotional development. Option D. Parental denial that a problem exists. The correct answer is option D. Parental denial that a problem exists. Diagnosing mental illness in young children can be complex due to their limited language skills, cognitive development, and emotional development. However, parental denial does not directly affect the child's. Question 12. A healthcare provider is providing care for a patient with schizophrenia. Which symptom would be considered a positive symptom of this disorder? Option A. Eulogia. Option B. Andonia. Option C. Delusions. Option D. Flat affect. The correct answer is option C. Delusions. Delusions are considered a positive symptom of schizophrenia. Positive symptoms represent an excess or distortion of normal functions, such as hallucinations, delusions, or disorganized speech or behavior. Question 13. In a patient with bipolar disorder, which symptom would indicate a manic episode? Option A. Excessive sleeping. Option B. Low self-esteem. Option C. Decreased need for sleep. Option D. Andonia. The correct answer is option C. Decreased need for sleep. The correct answer is C. Decreased need for sleep. A decreased need for sleep is a hallmark symptom of a manic episode in bipolar disorder. During manic episodes, individuals may experience significantly reduced. Question 14. Which of the following would be the most appropriate intervention for a patient experiencing severe anxiety? Option A. Encourage the patient to talk about their feelings. Option B. Use a firm, authoritative approach. Option C. Stay with the patient and provide a quiet environment. Option D. Suggest the patient watch TV to distract themselves. The correct answer is option C. Stay with the patient and provide a quiet environment. During a severe anxiety episode, it's crucial to stay with the patient and create a quiet environment. This approach helps reduce anxiety by providing a sense of safety and support. Encouraging the patient to talk. Question 15. Which characteristic identified during an assessment serves to support a diagnosis of disruptive mood dysregulation disorder? Select one that doesn't apply. Option A. Female. Option B. 7 years old. Option C. Comorbid autism diagnosis. Option D. Outbursts occur at least once a week. The correct answer is option C. Comorbid autism diagnosis. Characteristics such as age, frequency of outbursts, and occurrence in multiple settings support a diagnosis of disruptive mood dysregulation disorder, while comorbid conditions like autism can coexist with. Question 16. A patient with post-traumatic stress disorder, PTSD, is experiencing flashbacks. The most appropriate intervention is to: Option A. Encourage the patient to talk about the trauma. Option B. Help the patient reorient to the present. Option C. Leave the patient alone to process the flashback. Option D. Remind the patient that the flashback is not real. The correct answer is option B. Help the patient reorient to the present. When a patient with PTSD is experiencing flashbacks, the most appropriate intervention is to help them reorient to the present. This intervention can assist in reducing the intensity of the flashback and providing a. Question 17. Which drug group requires nursing assessment for the development of abnormal movement disorders in individuals taking therapeutic dosages? Option A. SSRIs. Option B. Antipsychotics. Option C. Benzodiazepines. Option D. Tricyclic antidepressants. The correct answer is option B. Antipsychotics. Antipsychotics choice B are the correct answer because they are strongly associated with the risk of extrapyramidal symptoms EPS and other movement disorders due to their dopamine receptor blockade in the. Question 18. Which neurotransmitter is primarily implicated in the development of schizophrenia? Option A. Serotonin. Option B. Norepinephrine. Option C. Dopamine. Option D. Acetylcholine. The correct answer is option C. Dopamine. The correct answer is dopamine. Dopamine dysregulation is a key factor in the development of schizophrenia. Excess dopamine activity in certain brain regions is associated with positive symptoms of schizophrenia. Question 19. Which of the following is a negative symptom of schizophrenia? Option A. Hallucinations. Option B. Delusions. Option C. Alogia. Option D. Paranoia. The correct answer is option C. Alogia. Alogia, also known as poverty of speech, is a negative symptom of schizophrenia. It refers to a reduction in the amount of speech or the feeling that one has nothing to say. Hallucinations and delusions are positive. Question 20. In the treatment of generalized anxiety disorder, GAD, what medication is frequently prescribed as a first-line treatment? Option A. Clonazepam. Option B. Buspirone. Option C. Propranolol. Option D. Hydroxyzine. The correct answer is option B. Buspirone. Buspirone is often chosen as a first-line treatment for generalized anxiety disorder GAD due to its efficacy and favorable side effect profile. Unlike benzodiazepines such as clonazepam A, buspirone does not. Question 21. In the care plan of a male patient diagnosed with a dissociative disorder, the nursing diagnosis of ineffective coping is included. Which behavior demonstrated by the patient supports this nursing diagnosis? Option A. Has no memory of the physical abuse he endured. Option B. Using both alcohol and marijuana. Option C. Often reports being unaware of surroundings. Option D. Reports feelings of not really being here. The correct answer is option B. Using both alcohol and marijuana. The correct answer is B because using substances like alcohol and marijuana can be a sign of ineffective coping mechanisms in patients with dissociative disorders. Substance abuse is often used as a maladaptive way. Question 22. A patient with major depressive disorder is started on a tricyclic antidepressant, TCA. Which common side effect should the nurse educate the patient about? Option A. Hypertension. Option B. Diarrhea. Option C. Dry mouth. Option D. Weight loss. The correct answer is option C. Dry mouth. The correct answer is C. Dry mouth. Dry mouth is a common side effect associated with tricyclic antidepressants TAS. TAS block acetylcholine receptors, leading to anticholinergic effects, such as dry mouth. Question 23. A patient with major depressive disorder is started on venlafaxine. Which class of antidepressant does this medication belong to? Option A. Selective serotonin reuptake inhibitors, SSRIs. Option B. Tricyclic antidepressants, TAS. Option C. Monoamine oxidase inhibitors, MAOIs. Option D. Serotonin norepinephrine reuptake inhibitors, SNRIs. The correct answer is option D. Serotonin norepinephrine reuptake inhibitors, SNRIs. Venlafaxine is classified as a serotonin norepinephrine reuptake inhibitor SNRI. SNRIs work by increasing the levels of both serotonin and norepinephrine in the brain, which helps alleviate symptoms of depression. Question 24. A woman was abducted and raped at gunpoint by an unknown assailant. When found, she was confused and disoriented. The nurse makes the following observations about the client. She is talking rapidly in disjointed phrases, is unable to concentrate, and is indecisive when asked to make simple decisions. The client's level of anxiety can be assessed as: Option A, moderate. Option B, severe. Option C, mild. Option D, non-existent. The correct answer is option B, severe. The client's presentation, including rapid and disjointed speech, inability to concentrate, and indecisiveness, are indicative of severe anxiety. These symptoms suggest a high level of distress and impairment in. Question 25. Which statement made by a patient prescribed bupropion, Wellbutrin, demonstrates that the medication education the patient received was effective? Option A. I hope Wellbutrin will help my depression and also help me to finally quit smoking. Option B. I'm happy to hear that I won't need to worry too much about weight gain. Option C. It's okay to take Wellbutrin since I haven't had a seizure in 6 months. Option D. I need to be careful about driving since the medication could make me drowsy. The correct answer is option A. I hope Wellbutrin will help my depression and also help me to finally quit smoking. Choice A is the correct answer because it shows that the patient understands the dual benefits of bupropion Wellbutrin in treating depression and aiding in smoking cessation. Bupropion is commonly prescribed for